Hello dear judges, organizers and participants of the conference. My name is Polina Hutornaya. I'm a fourth year student of medical faculty, and the topic of my research today is treatment of SMA, a miracle for the hopelessly ill. First of all, I would like to clarify what SMA is. It stands for spinal muscular atrophy. The mechanism of this disease is quite complicated, but I will try to tell you in a nutshell. The development of spinal muscular atrophy is caused by mutation in SMN1 gene, which encodes a motor neuron survival protein. This protein is key in the function of the spinal cord and therefore in the performance of all our body movements. Reduced levels of SMN protein lead to defects in motor neurons, stunted growth, abnormalities in synapses, and eventually to motor neuron death and atrophy of all muscles. In addition to SMN1, the SMN2 gene has been found in human chromosomes, which is a copy of it and is similarly responsible for the synthesis of survival protein, but in much smaller amount that are insufficient for normal spinal cord function. The classification of this disease is based on the severity of the mutation and therefore the amount of motor neuron survival protein that we need. Patients with type 0 have a minimal amount of the protein and don't even reach the age of 1 year, let alone be able to sit or walk. People with type 3 have a comparatively higher amount of this protein and can survive into adulthood. The clinical picture depends on the type of SMA, but in general, progressive peripheral paralysis and eventual death from respiratory failure due to paralysis of the respiratory muscles are the most common symptoms. Despite the fact that most patients at birth seem completely healthy, symptoms soon begin to appear, and such patients require a lot for normal life. Corsets, special diets, massages, regular exercises, breathing aids, mobility chairs, and so on. And these are just some of the devices that they need to maintain their necessary condition. Until recently, the disease was considered incurable, and unfortunately, families were forced to watch their children slowly die. Salvation came in 2016 from the United States. After long and expensive research, a drug called Spinraza was finally developed. It can increase the amount of the vital motor neuron survival protein we already know. This made it possible to freeze the course of the disease and not only prolong, but also improve the quality of life of patients. But there is another side of the coin. The price of such a drug is $750,000 for the first year of treatment and $375,000 for the following years. And top of that, patients have to take it for the rest of their lives. A similar drug is risdiplam, and fortunately in 2020 and 2022 these drugs were included in the list of vital necessities and are now available for free in our country. Another drug is Zolgensma. The mechanism of its work is very complicated. In simple terms, it is a virus that introduces a copy of gene responsible for the motor neural survival protein into the human genome, and consequently it fixes the broken part of DNA Isn't that a miracle? The price of this drug is $2 million, and of course it is considered to be the most expensive medicine on our planet. But its great advantage is that it is injected only once under 2 years, and now we can declare about curing patients with such incurable disease. Gene therapies like Zolgensma have such a high price tag because they have very expensive research costs. The cost to make them is also extremely high. The manufacturing and development cost required for the production of gene therapies is usually much higher than compared with traditional drugs. Although Spinraza isn't a gene therapy, it still requires expensive research as well. There are 1,266 patients with SMA in Russia, and 80% of all patients are currently being treated with various medications. As we already know, the treatment costs an arm and leg, so there are non-profit charity organizations in Russia that accept donations to help, such as Family SMA or Helping the Rare. In conclusion, I would like to say that we as doctors have to educate people with such devastating diseases, and if you wish, you can look into activities of these organizations and help patients with this rare and extremely severe pathology. Thank you for your attention.